I would like to begin tonight by acknowledging the traditional custodians of the land on which we live, work and play. We at the University of the Sunshine Coast pay our respects to local Indigenous elders, past, present and emerging, and recognise the strength, resilience and capacity of all Aboriginal and Torres Strait Islander people. I'm joining you from Kabi Kabi country tonight, and I'd like to extend my respects to any Aboriginal and Torres Strait Islander people joining us this evening. So, first of all, to give you an overview, I'm going to introduce our incredible panelists tonight. So, as I mentioned, my name is Bridie Keane, and I'm the program lead of our postgraduate programs in health promotion, which I'll go into a little bit more detail about shortly. A little bit of background about myself. I've been at the University of the Sunshine Coast now for a decade. It was a decade this year, and prior to that, I completed a Master of Public Health, and then I did my PhD research here as a student at the University of the Sunshine Coast while teaching into our public health discipline, and then became an academic in the public health team, and have had the privilege to teach alongside these incredible academics you're going to hear from tonight. So I'm going to start by introducing Dr. Rachel Cole. Rachel has a background in health promotion, epidemiology, and exercise physiology. Rachel has worked in public health for nearly 15 years. Rachel holds both an academic appointment at the University of the Sunshine Coast and also works in industry as a health promotion practitioner. So, Rach, I'm going to throw to you and start off by asking you what you are most passionate about working in this field of health promotion and public health.
Thanks, Bridie. What do I love about health promotion? I love the fact that we get to influence health and wellbeing of whole populations at a time. And I really enjoy the upstream approaches to health promotion and being able to structurally address some of the determinants of health and wellbeing to have population effect. I suppose my interest areas are in urban planning and also transport planning and how those factors and policies and practices influence health and wellbeing. Thanks, Bridie.
Thanks, Rach. We're really looking forward to hearing from you tonight. I have been privileged to teach alongside Rach in our health promotion technical courses this semester, and her wealth of knowledge is incredible. I'm now going to introduce Dr. Cara Lilly. I've worked with Cara, Cara, I don't know how long we've worked together for now, for at least 5 years, but that is just a tiny part of Cara's extensive career. Cara has a wealth of experience in health promotion, working in a diverse range of roles across 15 years before joining the University of the Sunshine Coast as an academic. Cara, I'd like to ask you what you're most passionate about in the area of health promotion and public health.
Thanks, Bridie, and hello to everyone. I find this question really difficult. I have so many different areas of health promotion that I love, but I guess similar to Rachel, I moved from a role working around individual healthcare, and I really loved the prospect of being able to go and influence health, not one at a time, but thousands at a time, and really have that impact. And probably more recently, and off the back of my PhD in local policy processes, I've gotten really interested and intrigued around how we actually influence policy decisions, and to understand that we need to really understand how policy decisions are made. And so that's been my area of interest and passion for the last couple of years.
Thank you so much, Cara, and we're looking forward to hearing from you soon as well. Our final academic to introduce tonight is Dr. Faith Alele. Faith has an incredible background. Faith has actually just recently joined us at the University of the Sunshine Coast, but before coming to the university, she has worked across an incredible range of different careers, starting out as a medical professional. So Faith has a medical degree and also has a lot of experience in epidemiology and experience working in the field as a public health clinician in southwestern Nigeria. So a lot of clinical experience as well as extensive research experience now in public health. Faith, can I ask you, what are you most passionate about in public health?
Hello, everyone, and thanks, Bridie, for that. regarding public health, I think one of the key things that I love about it and passionate about is the fact that it allows one as an individual or a health professional to address multifaceted challenges. And so you develop skills, or you have skills that you bring on board, and you use that to tackle complex issues that could impact individuals and communities at large. And apart from that, it also allows one to make tangible differences in the lives of people and in the community as well. So that's one that I would say that's what I love particularly about public health.
Thank you, Faith. And thank you all for sharing your experiences tonight. Even though we all work together, it's so refreshing and nice to remind ourselves of why we do what we do and how lucky we are to work in this area and contribute to the health and wellbeing of so many people through the roles that we have as researchers and academics in this space. Before I do jump into the masterclass and the program details, I want to actually just cover some housekeeping. So as you can see, this webinar will be recorded, or is being recorded this evening, and a recording of this will be sent out to you all those who have registered in the next couple of days. You will also see that there's a Q&A function. So if you do have questions, we encourage you to use the Q&A function rather than the chat, and you can enter those questions anytime throughout the webinar. We'll be able to monitor them. If we do not get to your questions, we'll, at the end of the webinar, I'll go over how we can stay connected, and we want to make sure we cover all questions you have. So if we don't get to them tonight, we definitely will follow up. And I think I have covered all the housekeeping on my notes, or else I'm going to get a message from Phil and he'll remind me anyway. So we might jump into the program information. So tonight's webinar, we're going to cover a program overview, a little bit about our content, some pathways you can expect that our two health promotion programs can lead to. Then there's going to be a masterclass where our team of experts are going to give you an example of the types of learning that you do in our postgraduate space. And then we'll get to as many questions as we can. So I'm now going to, I'm having a great time getting these slides. Next slides. Great. So in our postgraduate program, we have two programs. We have a graduate certificate in health promotion, and we have a Master of Health Promotion. So our graduate certificate can be completed in 6 months. That's full time, or essentially it's 4 courses. Our Master of Health Promotion is 2 years, and it's 16 courses. In both our programs, they cover the field of health promotion, and health promotion is a sub-discipline of public health. And Rachel is going to explain a little bit more about that in our masterclass. Both programs are delivered completely online, and they are completely online asynchronous, meaning you can work through them at your own pace. So each week there is a module, and you can work through that module at your own pace. Having said that, we are actively teaching these courses, and we are available face-to-face via Zoom. So each course in our program will have a course coordinator or lecturer who will run a weekly Zoom session. And that Zoom session is fantastic for jumping online to connect with the course coordinator or lecturer, meet other peers that are on a similar learning journey, discuss any thoughts you have about the course, but it is optional. So you can work through our postgraduate programs completely on your own without connecting with us, if that is your preferred format. To give you an idea of the type of way you will learn, we're going to also send out a taster module with the same email that will hold this webinar recording. And that taster module will be an example of the type of setup that your weekly learning materials come in through the program. So that will be coming from the University of the Sunshine Coast in the next few days. So I'll go into a little bit more detail about the two different programs. So our graduate certificate in health promotion, that's the pathway that is 6 months or 4 courses. Some of our students, particularly at the moment, are taking it slower than 6 months. So they might be enrolled in 1 or 2 courses per semester, as they're doing that alongside full-time work and employment. And the graduate certificate is really suitable for anyone who wants to embed health promotion, knowledge and skills into their current employment or career pathway. So examples of this might be, and our current students are a lot of people who are working in health and then can see that their role would really benefit from integrating health promotion concepts, knowledge into their current role. So we have a lot of allied health professionals. This pathway is really suitable for nurses, teachers. It's suitable for people already working in a health promotion role that may not have had formal health promotion training. So that's a little bit about our graduate certificate in health promotion. The courses that you take in the graduate certificate in health promotion are courses that are also in the Master of Health Promotion. And our Master of Health Promotion is a 2-year program when taken full-time. And our Master of Health Promotion degree is internationally accredited with the International Union for Health Promotion and Education. So when you graduate from the Master of Health Promotion, you become an internationally recognised health promotion practitioner upon completion of that degree. The Master of Health Promotion has capstone courses in both research and practice. So you come out very expertised in health promotion technical skills, and you also have a research pathway. So if you do have ambition or intent to go on to do a higher degree by research, such as a PhD, the Master of Health Promotion can certainly start to put you in good stead for that type of pathway. So to summarise, in terms of the two different pathways, the graduate certificate is perfect for embedding knowledge into any field, whereas the Master of Health Promotion will lead you to become internationally recognised, and it's perfect for if you are after a career in health promotion. So now I'm going to hand over to Dr. Rachel Cole to kick off our masterclass. Thanks, Rach.
Thanks, Bridie. Okay, our masterclass tonight. So the focus of our masterclass tonight is on the systematic approach we use in health promotion to respond to a public health priority. We thought we'd go through this process because it will give you a bit of a feel for the type of knowledge and skills you'll gain through our programs. So to showcase the approach that we use, we're going to use a case study example, which is gambling, which we thought for a bit of fun, it was quite topical given it's the racing season in Australia here. So the session will start by briefly overviewing health promotion and the systematic approach we use in health promotion practice. We will then demonstrate the application of one part of that health promotion practice cycle using gambling to understand the priority and design actions. So firstly, we might start by defining or describing what health promotion is. Health promotion involves working with individuals, communities, and whole populations to plan, develop, implement, and evaluate policies and programs that enable people to increase their control over the many determinants of health, or those things that influence health and well-being. And Cara will talk to you a bit later more about this. By doing that, we're thereby improving the health and quality of life of people and communities. Health promotion strategies include things such as health education, social marketing, and mass media, which most people think about when they think about health promotion. But it also includes community development, community engagement, advocacy and lobbying, workforce development, and capacity building. Health policy and other structural actions directed towards changing social, environmental, political, and economic conditions to create health and wellbeing in populations. Health promotion is often referred to as upstream systems approaches to creating health and wellbeing and having a focus on equity populations and supporting those who need it the most. A lot of our work involves working with sectors outside of health that influence the determinants of health and those factors that determine health and wellbeing in communities, such as housing, education, local government, and urban planning sectors. In planning health promotion action, there's a systematic health promotion practice cycle we use, which is typically described as having 4 iterative phases. The first is community health and wellbeing assessment, which is also known as health needs assessments. Here we partner with communities using participatory and co-creation approaches to systematically assess the health and wellbeing of a community using a range of data, which include the voices of community and stakeholders to understand their health and wellbeing visions, the health assets and needs in the community. We then prioritise these with the community on what we're going to take action on. The second phase is planning. This is where we systematically analyse the determinants of the health and wellbeing priority we're going to action, which we'll go to in a lot more detail tonight in the masterclass. And given what we find in that analysis, we then plan what we're going to do about it and the resources, using the resources we have available to us. This phase also includes planning how we intend to evaluate whether our actions are effective. We then move into implementation. This is where we carry out our planned actions with our partners, stakeholders, and community, monitoring the quality of the approach using process evaluation as we roll them out. When actions are being carried out in a quality way, we can then evaluate them to assess whether what we did actually worked and whether it made an impact on the health priority itself and those factors affecting it. The focus of our application of the health promotion practice cycle tonight using gambling is on the first phase of the planning cycle. Here we assume gambling has been prioritised as a public health priority by the community as an area for action. The first step towards planning how to address a health priority in the cycle is firstly understanding the priority in detail. This includes clearly defining the priority for investment so everyone has a common understanding of what the priority is and how it impacts the community. We then determine who is being most impacted by the priority and where, and also assess why the priority is occurring within the community and the factors or determinants contributing to it. We do this using the literature, existing data, and engaging with the community and stakeholders. If we can understand who is impacted and where, we know who we need to engage with in our programs to address the priority. And if we can understand the root causes or contributing factors of the priority, we can then put strategies and actions in place to address the determinants to sustainably change the health priority in structural ways. I'm now going to hand over to Faith, who is going to start unpacking gambling as a public health priority using descriptive epidemiology. Thank you, Faith.
Thank you, Rachel. And so we're moving to talk about the what's, the who, the where, and Cara will handle the why in problem gambling. I'll just move on to the next slide. Gambling, if we were to start the definition, can be broadly described as playing a game of chance or skill in which you stake something valuable that has a potential for a prize win, and includes the examples I've listed here, including pokies, informal betting or formal betting, bingo, the lotto, the powerballs, the scratches, which many of you would know, raffles, and competitions, including speculative stock investments like the day trading. If we're to move on, so we've defined what is gambling. Now let's talk about the impact of gambling. Gambling as a public interest. Why did we move back? Back to the slides. Great, thank you. In terms of gambling as a public health interest, we'll talk about public gambling, and we'll talk about defining it as difficulties in limiting money and or time spent on gambling, which leads to adverse outcomes for the gambler, others, or the community. And from a public health perspective, we're interested in problem or risk gambling due to its burden on the health and well-being of individuals and the society at large. Problem gambling has been found to cost the nation overall about 4.7 billion socially per year on financial as well as social services. For every one person with a gambling problem, you have 6 other people who are affected, and these include family members, friends, or even the wider community. And so there are lots of health-related impacts in relation to gambling. For example, when we talk about the mental health impacts, we're talking about things like distress, depression, anxiety, or stress. When you talk about the social impact of gambling, we're talking about the large impact it has on relationships, including family relationships, or things like marital breakdown. We also have the physical health impact of gambling, and that will be a range of psychological conditions or physiological health conditions, as well as food insecurity. And then when we talk about the spiritual health related to gambling, we're talking about the loss of sense of purpose, low self-esteem, or actualization. To understand problem gambling and effective driven as an evidence-driven way, I beg your pardon, we first need to be able to measure. So we're talking about what? We've said, what is gambling? But then how do we measure or define gambling? And so we measure problem gambling by using what is called the Canadian Problem Gambling Severity Scale. Now, this index is assessed using a survey, and the survey consists of 9 questions about people's attitudes and behavior towards gambling, and where participants rate each question on a scale. And for example, one of the questions would be, have you bet more than you could readily afford to lose? And the responses would be on a range from 0, which would be never, to 1 sometimes, 2 most of the time, and 3 almost always. And the responses to all of these questions are combined together to assign an overall problem gambling category. And if we're to move on, I have talked about the what, now let's talk about who in Australia. And when we're saying who, we're referring to Australian adults. What is the prevalence of gambling in Australia? Very interesting. Approximately 3 out of 4 Australians, that's approximately almost 75% of Australians in the last 12 months were reported to have engaged in some form of gambling or one form of gambling activity or the other. And of all of these, the most prevalent of them was the lotteries and scratches. And as you can see that there are other ones like the horse racing. The Melbourne Cup just ended anyway. I'm not saying anything. So be aware that there are quite a number of range of activities that people engaged in, and these were the reported prevalences for the different activities that people participated in the last 12 months as of 2022. And if we then move on from talking about the prevalence on gambling, I want to talk about the gambling expenditure by state and by territory from 2001, between 2001 to 2002, to 2019 to 2020. And that is me describing, this is us describing where and when. So we've talked about what, we've talked about who, now we're talking about where and when. Very interesting graph that you can see plotted on the screen here. And we've picked a few dates for you to see over time by the different states and territory. If we were to start by each state or territory, we'll find out that the state that has the highest reported expenditure over the last years from between 2001 and 2020 is New South Wales. And then following closely is Victoria. And then you can see Queensland as the third state when it comes to the amount spent in billions. So this is how much is lost in billions over the last years between 2001 and 2020. And then one of the examples we have here was between 2017 and 2018, where about 10 billion was lost in New South Wales, and in Victoria it was 6 billion lost in 2017, between 2017 and 2018. Interestingly, when we had the pandemic, and that was COVID-19, between 2019 and 2020, the amount lost to gambling dropped. And that was as an effect, which the reports have shown that was an effect of the pandemic. And we can see that it did drop for New South Wales to 9.6 billion. And then, interestingly, for Victoria, it dropped to 4.6 billion. Northern Territory was less than $1 billion overall, like 0.30 billion. And so that tells us a lot about the trend. Like the graphs tells us a lot about the trend over the years. We can see where there's a dip, we can see where there's an increase, and we can look. The trend allows us to determine, are we doing in terms of whatever service we want to implement or prevention strategy, are we doing it right, or do we need to do more in relation to that? And so moving on from there, I will be handing over. I'll be talking about the risk of gambling harm, beg your pardon. And when we talk about gambling, the risk of gambling harm, we're talking about those that are at risk or identified to be at risk of having developing gambling problems. And we found out from the literature that 46% of Australians aged over 18 and above have been reported to be at risk of gambling. And those who are 18 to 34 years of age, at least the young adults, were at increased risk of gambling compared to older adults. So this tells us a lot about those who are at risk. And we've defined already we've defined the where it's been occurring. We've also defined the time period or time frame in which all of these have occurred over the last number of years. And so I will now hand over to Cara, who will then talk to us about why and also talk about the determinants of gambling. Thanks, Cara.
Okay, thanks, Faith. So yeah, I'll have a chat to you a little bit about the reasons for why we have these risks of gambling harm. And in health promotion, often we talk about these reasons as the causes of the problem, or refer to them as the determinants for health priorities. So you may have heard terms that refer to determinants, things like risk factors or protective factors or promotive factors. And what makes a health promotion approach different to many of our colleagues, perhaps in clinical settings, is that we draw on ecological science. And essentially what that means is that we look at what the causes of ill health or social health issues are from an individual perspective. So the things there that we look at, like biological factors or behavioural factors. And then we also look at this environmental perspective. So things about where you live and where you work and broader political environments. So it's these structural causes or determinants that then have the greatest influence at that population level on being able to contribute to health equities. So ultimately, the ecological science approach that we take makes us think about health in a really broad perspective, not only about an individual or a patient or a client, but acknowledging that those individuals exist within these multiple settings and multiple ecosystems, and that we can't separate them. They're all interconnected and interdependent. So if we look at our case study around problem gambling, and Faith has already introduced earlier the definition of problem gambling. So it's where there's adverse consequences, either for the individuals or the community. And I'll come up with some determinants of the causes of problem gambling, and it won't necessarily cover all of them, but it gives us a bit of an understanding around how we actually apply this ecological science lens. So from an individual level perspective, we might think about some cognitive factors. People might have a limited knowledge about what responsible gambling looks like, or awareness that problem gambling can be a health issue. Think about their behaviour. So things like alcohol consumption can influence gambling. Your personality, just having a risk-taking personality, can also put you more at risk, or your socioeconomic environment. So we know people on low income or that are unemployed are more likely to gamble or be problem gamblers. And then we think about our environmental level determinants. So things like our social environment, and gambling being such a normalised social activity that you do with your family and friends. So if you have poor social networks, you're more likely to go out and socialise using gambling activities. And our built environment, or our physical built environment, means that where we've got increased numbers of gambling venues, you're more likely to be a problem gambler. And of course, those gambling venues are more likely to go into areas where there's low socioeconomic disadvantage. Your home being in close proximity then to those gambling venues, and particularly where communities with fewer recreational options exist. Moving on to the cultural environment, it's pretty obvious that gambling is a fairly accepted part of Australian culture. So that's reinforcing all of these other environmental factors as well. Things in our economic environment, so gambling is a source of government tax revenue. So the government makes quite a lot of money out of these gambling industries. And then they're also investing back into evolving technology. So we know that we get lots of these online gambling platforms as well as a result of that. and our political environment. So there are some legislations and regulations to try and stop or put cease other gambling activities. So things like pre-commitment rules, ATM limit withdrawals in venues, things about when venues can actually open and close, and also the provision around support services. And the final one I'll mention is around our commercial determinants. So gambling is a major industry in Australia. It has its pros and cons. Obviously, it employs a lot of people into the gambling industry and provides a lot of people with employment. But gambling advertising at the moment has a little bit of free rein. And so we see a lot of gambling advertising, particularly targeting groups that are more vulnerable. So if we think about that as our range of determinants, and all of these are evidence-based, so we utilise our research or skills in analytical epidemiology to be able to come up with all of these determinants. And you will notice I have to acknowledge I have referenced these, but it was just too busy a slide if I actually put the reference list here on the slide. So if you're interested, I have got them available later in the presentation. And then once we know what's actually causing our public health priority, we can then go about trying to find some solutions. And the solutions ultimately respond to that range of determinants that we identified on that previous slide. And as health promotion practitioners, we look at enabling action at various levels, so both at the individual level and the environmental level, and mediating across a whole range of different sectors, and often using advocacy skills and to influence broader political change. So just some examples of recent discourse in advocating for gambling-free environments are things like credit card bans on online gambling apps, discussions around advertising bans, and inquiries into those close commercial relationships between sporting codes and gambling companies. And I used some of these examples quite intentionally, because as you can see, none of these suggested health promotion actions are targeted at that individual level. They look to influence the political, economic and commercial environments around gambling. And we know that that will have the most impact on problem gambling at a population level. And so before we finalise the masterclass component for this evening, I'll go back to that project management cycle that Rachel introduced at the beginning, which looks at our process. So we've identified the causes of problem gambling, planned and implemented our solutions, and now that final piece of the project management loop is to evaluate whether they work or not. And evaluating health promotion action makes sure that we can do the best to improve health and wellbeing for populations or all populations in an equitable and just way, particularly ensuring that we're doing no harm along the way. So we don't have time to go into all of the types of evaluation or the skills involved, though that is something that you would definitely learn in a health promotion degree. And the process turns into an iterative, ongoing cycle then. So once we've assessed the needs of the community, we plan actions, implement the actions, evaluate them, and ultimately evaluate the population health outcomes as well. And they're the skills in epidemiology and project management that we covered tonight, really form those foundational skills in health promotion. And once you know the skills and have those competencies, you can respond to any health priority anywhere in the world. And just to finalise, as we work in health, it would be very amiss of us not to include a caveat. We do recognise that in discussing certain health topics in any context can be a bit uncomfortable or confronting. And if you've had any previous personal exposure to issues such as problem gambling, and if this has raised anything for you tonight or someone you know, just to be aware that there are a range of helpful services and supports available, including the Gambling Help Online, which is currently on the screen. And I think that ends our masterclass for this evening. So I might hand back to Bridie so that we're able to respond to your questions.
Thank you, Cara. And thank you, Rachel and Faith, for delivering our masterclass. Thank you so much to everyone that has contributed questions. We've had 3 really interesting questions so far. I couldn't see them because I was sharing my screen, the slides, but we have been sharing them through. So the first question was, if you don't have a background in health, would you struggle with the content in the Masters? It's a really good question. It's to answer it, and I'm going to hand to Cara to fill in any blanks that I haven't covered, but what it is possible to do the Masters of Health Promotion without a background in health. And what we actually have in that first semester or first year is your foundation classes. And what's really important in that space is we do have a foundation public health class. And so in the introduction to public health, as health promotion is one of the sub-disciplines of public health, along with infectious diseases, epidemiology, and environmental health. And so in that introduction to public health, that's really where we set the foundation of what is understanding health at a population level. And what we do see, it's interesting, I guess, that for those who have come from a health background is also where we sort of position health promotion and public health within what we call the ecological health paradigm. So we consider, how do we understand public health from an ecological lens and consider the health and well-being of the population? So that is definitely an important component within both the Masters and the Graduate Certificate. So while you don't need to have a background in health, you do just need to have a passion for the health and well-being for people. I think that's the main thing. And then it is through those courses that you develop that foundational knowledge. Cara, have I just want to make sure I haven't missed anything. I know we've spoken at length about this. Do you have anything to add?
No, not at all. Just to reinforce that, I completely agree. I don't think you need to come in with any particular knowledge around health. You just have to have an interest in it and a real passion for it, and then we'll teach the rest.
Yeah, thank you. The next question we had was, how much epidemiology, biostatistics would you cover in the certificate or master? Again, I'll start this question off from a program perspective, and then I'm going to pass to Rachel, who has a lot of experience in our biostatistics and epidemiology courses. So it's a little bit different in the graduate certificate and the masters. So the graduate certificate has again a foundation research and evidence course. It's called Public Health Research and Evidence. And we do cover a little bit of an introduction to different types of research, particularly, quantitative and qualitative research that is used in public health and health promotion. So there is an introduction to different research designs, but it is in the masters that you do go into detail a lot more, or you have a specific biostatistics course. Staying on the grad cert before I pass over to Rachel, in terms of epidemiology, similarly in the Public Health Foundations course that I've mentioned, and Cara and I have both developed that course and had input from our team of academics in their areas of expertise. So we're really passionate about that course. There is an introduction to epidemiology, and it does it aligns with what you've seen tonight in the masterclass around understanding how we use epidemiology in public health to really understand public health priorities from a public health perspective, considering the who, what, when, and where. But it's not as in-depth as you go on to doing the masters. So I might hand over to Rach now, if you can describe a little bit more about, how much content there is in the masters.
Sure. In the master's programs, we have 2 separate courses. That one covers Foundations of Epidemiology, which is very much an introduction to epidemiology, where we cover, firstly, in the first third of the course, epidemiological concepts. So you can have an understanding of how we measure epidemiology, descriptive epidemiology, analytical epidemiology. In the middle part of the course, we go into reading epidemiological research and being able to actually draw that research together and develop epidemiological research questions and studies. Then in the last part of the course, we get a little bit into applications of epidemiology, where we start looking at how we actually apply that in practice. The courses in our masters are very much at the introductory level and very much designed to be about supporting health practitioners in understanding basic epidemiology and also working with epidemiologists so you can communicate effectively and support research out in the field. So very much at the introductory level, but getting a good understanding and foundation for what epidemiology is. In terms of our biostatistics, we have a quantitative research course which goes into that biostatistics space. Again, it's designed to be at a foundational level where you'll develop up the foundational statistical skills. So if you're reading some research on health, you can understand what those statistics are telling you. And it also allows you to work closely and communicate well with a biostatistician to support you in developing research or conducting any sorts of studies or anything else you'd like to do in the field as well. Again, that course is very much designed for a health practitioner, not to become a biostatistician. So it gives you those foundational skills to be able to take into a health promotion discipline and to be able to apply that in practice. Thank you.
Thank you. Faith, did you want to add anything to that, or has Rach covered that?
I think Rach has covered, yeah, I think Rach.
I think we've just had Faith pause for a bit, but also please let us know through the Q&A if you have.
Has covered most of it, but just to say that, oh God. Am I paused? Am I back on?
You're back.
Can you hear me? Great, sorry. Just to add that to what Rachel said, that both the EPI and the biostats are designed to be applied. So it's such a way that by the time you're done, you would have gained skills that you can actually take on board with you. So while we teach the theoretical parts, we also have applied aspects of both courses so that you can actually like embed them or find yourself applying them in real life or in real scenarios overall. So I think that's what I'll add to what Rach has said. Thanks, Rach.
Thank you. So our next question, these are really good questions. There have been plenty of anti-gambling campaigns. From your perspective, have any of them been successful? If so, why? And I'm going to ask everyone from the panel to sort of mention something about this. I'm going to start with saying on the spot, I don't have a campaign. I'm trying to think of a campaign that comes to mind, but I think that, you know, I'm thinking about different public health priorities we've taught in public health, and tobacco comes to mind as a really successful a success story for public health in Australia that we've used in public health foundations. So I'm hoping someone else in the panel has a gambling example. But what we see is it's like we've heard tonight, it's when it's not focused on individual behaviour, but we're addressing as many of those determinants as possible. And so we've seen in the example of tobacco that through different strategies, you know, some might address how we change policy and you know, tax cigarettes. Others might be educational and address awareness and people's knowledge of the dangers and health impacts of tobacco. So I think any that are successful, you start to see that they are those that are addressing as many determinants as possible. And I'm now going to see if someone else from the panel or might go round and get the opinions of everyone else. So Rach, I'm looking at you.
Yeah, thank you. Yeah, I think I don't have a gambling example either, but I think where we've tackled the determinants of that priority, we've had successes. And one of the other classic examples we tend to use is seatbelt legislation. You know, that saved so many lives over the years. And we can show through time how, you know, while we add to the actions addressing a priority, how that priority has changed over time, and we have had success stories. And tobacco is probably the classic example that we fall back on, because we have had so many actions looking at different determinants over time and showing that there has been an impact on the number of people smoking in our communities. Cara, did you want to add to that?
I will add to that. I probably will put my political hat on though. So in response to that, whether the gambling campaigns have been successful, I don't know a lot of the data specifically for like individual level campaigns where they try to look at trying to promote people, I guess, around the harms of gambling or why they should stop gambling. But I'll put my political hat on because I think they're a bit of a smokescreen. And what we do know around those environmental level determinants is that the gambling industry has got such a hand in the policy decision making with governments. And so the campaigns that you actually see on TV, like the changes now and the gambling ads at the end, they used to have a little tagline, you know, to gamble responsibly. And now they actually have to have a little bit more about, you know, you lose more, all of those sorts of taglines. But that's a negotiation between the gambling industry and the government around what they are willing to do. And to be honest, they probably have done their research to say it's not really that successful if we do those sorts of campaigns, because they don't want them to be successful. They actually want to continue to make a whole lot of money. And the government's a bit tired because of the tax revenue that they make out of gambling organisations. So they too are not particularly interested in them being successful. On the other hand, they do know that it causes a whole lot of social and health impacts. And so then they're trying to go, well, where do we draw the line? And what do we want to actually try and influence? And so they have these conversations around advertising restrictions and the like. What happens faster is at that individual level where they say, oh, people should pre-commit how much they're willing to spend, or people should be able to put limits on their own attendance at gambling venues and push it back to the individual level to try and showcase that that's where the problem lies. So it's very complicated, and I think that that's kind of what we've spoken to tonight, in that there's a whole range of different determinants. We need to address them at the individual level, we need to address them at the environmental level, but we need to also understand how interconnected all of those things are and really understand the process behind them. I think gambling's not alone. I think there are a whole lot of health and social issues that have these really broad political agendas. And of course, I'm obviously passionate about that and looking to continue to advance the competencies of our graduates to be able to call it out as it is and understand that political process. So I'll get off my bandwagon and hand over to Faith if you want to add to that.
Yeah, look, I share the same views with you, Cara, and to say that one advert that I think still stands out is "They love the game, not the odds." That was a campaign in 2016 by Victoria, responsible gambling campaign and all of that. I think it still stands out, and they try to get a lot of clubs to sports club to get their members enrolled and to support the campaign. So I would say on the surface, maybe, in the sense that it does reach out to a few people around, which it might not take, like, it might not actually have the huge or the big impacts which we want. So to some extent, yes, it might actually get to some people or some targeted group of people, but I still share the same views with Cara about the politics behind all of those campaigns. But that will not deter us or stop us from doing what we're supposed to do and still pushing forward for responsible gambling, or preferably, getting people to understand the impact of problem gambling. So thank you.
Thank you, Faith. And we might go in a different, just address the questions in a little bit of a different order, because the last question relates, and I think, Cara, if you could speak to what you were saying a little bit more about how often are health promotion campaigns up against big businesses? This comment, can you continue what you were saying? Because
yeah, probably just to reiterate that I think we are not even, or in the past, probably not even been up against big business. I think big business has always been in that political space, and health promotion has not had a real presence. I think that is really changing in the last 5 years. There has been much more public health presence and health promotion presence, and rather than sitting back and thinking, oh, we're not big players in this space, is changing that attitude around to, no, we actually do have something to say and we do have something to offer, and what we stand for is really important. So yes, we're up against big business, but it's really great to see that shift, and for I guess the change in the way that we're actually going to be approaching this is, rather than trying to negotiate behind the scenes, is that health promotion's really at the forefront, saying things like, we've got to stop political donations from large organisations. There's got to be some greater laws around that. And we have to have transparency around how much money is actually going from big business into government that has these influences over the practices in our systems. So I think that is changing, and it's a bit of a watch this space to see how quickly we can actually put ourselves up against big business in that political arena.
Thanks, Cara. I'm going to quickly answer a question and then field a question to Rachel and Cara. So one of the questions about completing a Master of Science in another area, would you need to do a graduate certificate first? So you don't need to do a graduate certificate as an entry to the Masters. They are two different programs, and the graduate certificate is essentially the first 6 months of the Masters, if that makes sense. So so you can apply directly to the Masters, or you can apply directly to the graduate certificate. I will also mention at this point that both the graduate certificate and Master of Health Promotion do have CSP places, so that's Commonwealth supported places for eligible students at the University of the Sunshine Coast, confirmed for 2024. We have that confirmed for 2024. So that information is available on our website, but that is a great thing for the programs. I'm going to combine the last two of the questions together and ask Rachel and Cara to speak to these. So the questions were, is the Masters useful if you're interested in health policy creation? And after taking a master's degree, what are the working possibilities, knowing that policy might be an area? So Rachel and Cara, can you sort of talk about the career outcomes of our graduates, and what are the possibilities in terms of working in health promotion, speaking to the masters particularly? Thanks,
We're
Rach.
both sitting back waiting.
Yeah, sorry.
Jump in. Yeah, so the career pathways, we have graduates go into health departments, into policy areas in corporate offices and statewide programs. We have graduates that go into local positions. Some of them are named health promotion positions. Others may be more implicit in terms of health promotion skills that people carry on into the health sector, whether they're project officers or program managers, or, you know, being in charge of an area of planning. We've also had people go into local government in terms of in community engagement and community development, those sorts of things. Can you add any more there, Cara, in terms of where graduates have gone?
I think if you're interested in specific areas, we've had graduates who've gone to some of the non-government organisations or international organisations that might work in specific areas of health, whether that's in mental health or diabetes or cancer, and they've taken on various roles. Again, probably not necessarily named health promotion, and I think that's one of the challenges in our workforce, is they're often not named specifically, but they might be project management roles, community engagement roles that you can do in all sorts of different areas. It really is so diverse that the skill set, though, is really sought after by a whole lot of organisations. So once they can understand what health promotion graduates can actually do, they start to seek them out. So we've seen that through our primary health networks throughout Australia, who have acknowledged that whilst they have a huge portfolio in health, they actually really need the skill sets that health promotion has around research, epidemiology, and project management. So I think that that's still evolving as well. And definitely, if you're interested in health policy, a Master's of Health Promotion will be a pathway to that.
Thank you both. And again, I will just mention, so in the chat, Phil has placed a form for you to answer some more. I'm checking what is that form. Yeah, if you have more questions for us, you can enter that into that form so that we will definitely get them after the webinar as well. But we do have a couple of minutes, only a couple more minutes left, so we'll try and get to at least one or two more questions. One of the questions was that gambling is obviously a huge issue. What other areas are of growing concern? And I'm going to sort of tie this into, do you think health promotion plays a role in our changing climate's impact on health? As when we saw those questions answered one after the other, that is definitely an area of concern, and an area where our learning and teaching is becoming focused, because it is one of the major areas of concern. We also saw everyone will still have a lot of memories of the recent pandemic, and health promotion had a critical role in managing pandemics. So we heard a lot about epidemiology and the role of epidemiology in understanding the numbers around COVID-19, but in understanding how people from priority population groups were not, COVID did not affect everyone equally, or a pandemic does not affect all people in a community so equally, and the role of health promotion was significant in the COVID response. So in mind with that, I might just ask Cara to speak about sort of an example of how we're focusing on climate as one of our really important issues that we're focusing on in health promotion.
Yeah, it's a really good question, and thank you for picking that up. It's certainly something that the public health and health promotion profession has really picked up in the last couple of years around our relationship between health and climate change in particular. I think we just saw in the last couple of days, the World Health Organization has put out another urgent call that, climate change and health are so intricately linked. Without a planet, obviously, we don't have population health outcomes. So we have, as Bridie said, started really integrating that into our programs, both from, looking at how healthcare services contribute to the whole climate change cycle. So it's a little bit of that irony around healthcare wanting to improve and treat and cure health issues for everybody, but in fact we're contributing to this cycle around poor planetary health as a result of waste and the decisions that get made around the different types of medications and uses within those settings. So that, I think, is a really good example where we've leaned into the role of healthcare and climate change and how these systems are really working together. And we talk a lot then around climate justice as a global issue, so that when you're looking at climate change and planetary health, everyone's contributing to that around the world, and developing countries are the ones that are most at risk as a result of developed countries who are causing the problem the most. So we've got these inequities globally, and then we have inequities, as Bridie has said, within certain priority population groups. So yeah, I think that it's definitely a key role and definitely something that we have integrated through our postgraduate programs.
Thank you, Cara. And I have realised the time, and so we will have to finish up with that as our last question. But Phil has sent the form through to you. The other way you can get in touch after this webinar is through my email address directly, or if you do have sort of program related questions or about eligibility, do recommend eligibility. It's really important to consider each application. So if you do have any questions about eligibility, feel free to reach out to myself or directly to this information. I want to thank you all for spending some time with us on a Tuesday evening. Please reach out if there is anything else we can do. And I just want to extend my thanks to Phil in the background from the University of the Sunshine Coast Marketing and Events Department, Dr. Rachel Cole, Dr. Faith Lilly, and Dr. Cara Lilly. Thank you so much. And we hope you have a great evening. Thank you.